Well, meanwhile, my next guest writes, quote, "It's not just Minnesota or just daycares. The deepest government honeypot is blue state Medicaid in general." Joining me now is journalist and author Alex Berenson. Alex, great to see you. Thank you for being here. Let's first start with New York. I mean, New York has, what, about $120 billion it spends on Medicaid for all kinds of things. And so, I mean, it really overshadows, at least in terms of money, the situation going on in Minnesota. Is it fair to assume that there is a similar level of corruption here to go along with all that extra money?
I mean, I think there's evidence that there's more corruption. First of all, if you look at other states, New York spends far more than other states. Even other northeastern states, New York spends about double what New Jersey spends per person, not overall, per person I'm talking about. And then if you just think about, so New York's spending about $120 billion, okay? That's almost $20,000 per Medicaid recipient, not Medicare, Medicaid. These are people who should be younger and somewhat healthier and need, fewer services. Obviously, some of them are quite sick or addicted or have chronic conditions. But overall, I mean, that's just a massive amount of money. And then when you actually look at where the money's spent, increasing amounts of it are spent on things like home health care aids, which is a program that is just unbelievably ripe for fraud that I'm going to look into. And another thing that's happened in New York in the last few years is New York got a waiver from the Biden administration to spend Medicaid money on what are called social determinants of health. So that basically means not real medical care. That means, we think housing is a social determinant of health. It essentially turns Medicaid into basically a welfare program. So for all these reasons, and then if you look at the last 10 or 15 years of Medicaid in New York, there's been a number of specific fraud cases that have been brought where it's just straight fraud. So here's the thing. When you set up a government program in a blue state and you sort of backstop it with federal money, as they saw in Minnesota, as they see in California, as they see in New York, there are going to be very strong incentives for people to just come and steal with both hands. And oftentimes the state doesn't particularly care.
Yeah, and you also mentioned this. It's kind of an anecdote, but you provide evidence to back it up that there are cases of people taking taxi rides for like $2,000 a trip from New York up to Boston and back again to go to a specialized medical service. Not a good way, not a practical money-saving way of providing health care. Again, it may not be outright fraud. It may be legal to do, but that should be a problem, that it is legal to waste money like that.
Well, that's right. When you have a government program that essentially has no, I mean, listen, the government can try to put guidelines and guardrails on stuff, but ultimately the person getting the service is not spending the money, probably doesn't even have any kind of copay, and so doesn't really have any incentive to choose more reasonable care, more cost-effective care. And so this is what you see happening. You see somebody taking a taxi ride that is the price, and it's not an exaggeration, the price of a business class airline ticket from New York to Los Angeles and back, the cost of that taxi ride. But if you're the parent, you don't care. Someone else is paying for it. And I understand why that parent wants, what they think is the best care for their child or what they've been told is the best care. But ultimately, when you set up a honeypot like this, it's going to attract scammers.
Now, has anything really directly come out at you so that sort of screams of real corruption? That is, have you found any evidence yet of real corruption, the likes of which we're seeing in Minnesota?
So I think the sort of the most target-rich environment for me as a reporter, and I have this Unreported Truth Substack where I write stuff. A long time ago, I was a reporter for the New York Times, but these days I write independently. The thing I think I'm going to chase the hardest right away is the home health care stuff, because it is so obviously ripe for fraud. That's a situation where you just, essentially you just fill out a form and say, well, I'm taking care of my disabled relative, and you get a check. Right. And there, I believe, and I'm going to look into this, there are places that will actually help sign people up and take a cut of that check. So it's a little bit like Social Security disability, where there are law firms that will help you get SSDI. and then they take a percentage of it. And when you have a situation like that, you're practically begging for fraud.
Yeah. And I don't know if you heard my interview with my last guest, but already CBS is coming out and saying that the report, Nick Shirley and other people have been reporting, people like you have been reporting on their own, is a bunch of malarkey. It's not true that there are children going to these daycare centers that appeared to be shuttered before. I'm sure they're going to go after you as well. Is there anybody, you must still have contacts in the New York Times, isn't it something that some reporters that are working for these mainstream media outlets would be interested in investigating?
So that's a great question. And once upon a time, I think mainstream, or what I sometimes call legacy media outlets, were more interested in government fraud, right? These days, because everything in news and in journalism is political, it's like they're afraid that if they write about government fraud, it will tarnish Democrats and government programs, and they don't want to do that. I think that's a mistake. I think ultimately what it leads to is backlash, like the immense backlash we're seeing about what happened in Minnesota. But that is their ideology. And listen, from my point of view, it's great because it means people are going to go to my Substack. They're going to go to Unreported Truths and read it.
Well, thank goodness we have Substack. Thank goodness we have Ex Post. The citizen journalists, particularly one that's well-trained like yourself, are going to be really getting much more of the spotlight now. And I think that as the mainstream media goes down, the citizen journalist is going up, and people will pay more attention to that. Alex, we got to leave it.
David, thanks for having me.
Absolutely. Come back anytime. Great to see you. Appreciate it.